So you mentioned depression. That's something as well that you can diagnose and treat at the Kids Center as well?
You know, we don't diagnose depression. Usually people come to us from therapists or other doctors who have depression, and, you know, they're seeing a therapist, and, you know, very commonly therapists refer people to us because they realize that, you know, what they're doing is great and it's a part of the puzzle, but there's something else going on. Again, from my perspective, depression is a symptom of some underlying problems. And we've had, you know, scores of patients come in and we do these metabolic tests and we find that their body just isn't working well. And when your body isn't working well from a biochemical or neurological perspective, symptoms will arise. And in some people, those symptoms may be depression. So we look at things like MTHFR gene mutations, and we look at other genetic mutations like COMT or MAO, and we look at the methylation cycle. We look at toxicity levels. So many different factors that could be playing into why this patient has anxiety, depression. We know that the biopterin cycle, which is involved with this whole methylation system, allows us to turn amino acids like tyrosine and tryptophan into dopamine and serotonin, which are our main neurotransmitters. And without a healthy gastrointestinal system and sufficient vitamin D, as well as normal MTHFR status, you're predisposed to having depression. So sometimes all it takes is you know, some increased stress to tip the iceberg, you know, to tip off the iceberg, and, you know, next thing you know, you have a full-blown depressive event. So we look at the whole system, and our goal is to treat the patient as a whole unit.